everybody. Thank you for having me here, FreeMind. I'm looking forward to telling you about our program. I am the Director of Investor Relations, which I'll get to later in the presentation. First and foremost, I would like to just tell you about our program in general and all of the funding that we have available to oncology startups. All right, so just to go over the SBIR programs in general at NIH, there's 27 institutes at NIH, 24 of them have the SBIR and STTR programs. And what that means, so any federal agency that has an extramural R&D budget of over 100 million is mandated to have an SBIR program. And then those agencies with the budget of over $1 billion are mandated to have the STTR program. And so you can see here, this was our budget for the last fiscal year, right around 203 million for our program alone. At NIH for these programs, it was 1.3 billion. And so this is funding, really is where kind of like the seed funding that a lot of people kind of require at this moment. To be eligible for our program, you must be a small business concern based in the United States. You have to be more than 50% owned by US individuals and independently operated. And you have to have 500 or fewer employees, which is typically not an issue at all for the startups that we fund. The award is always made to the small business. So why seek funding? Number one, it provides seed funding for your technology, especially in the funding times like right now. I think it's extremely important. And this is not a loan. This is completely non-dilutive. We don't expect any kind of repayment. The IP stays with the company. So it truly is just money for your company. It also provides recognition and visibility. You go through a peer review process. So when you are going out and seeking additional funding, you can really say that you've received these grants which have been validated by the NIH peer review process. So yeah, it helps attract additional funding. And so for our program, these are our phases, and these are not to be confused with the clinical phases. These are just truly funding phases. So our phase one is up to $400,000 for proof of concept work for projects that will last anywhere from 6 to 12 months. Our phase two goes up to $2 million, and these are projects for around 2 years. And with those projects, you're required to submit a commercialization plan, and this is really just to further your R&D. We have a phase 2B bridge award, which it's actually $4.5 million now, and you're required to get matching funds. And if you have a phase 2 SBIR award from any other department, but you have an oncology application, you can still apply to our phase 2B bridge award. So you don't necessarily have to have the phase 2 with our program. And then phase 3, you're expected to use non-SBIR funds for commercialization. And then we also have the direct to phase 2. If you already have some of that proof of concept data and you're a little bit farther along, you can come in through the direct to phase 2 route. The application for that is quite a bit more dense. And then we have a fast track application where it would combine the phase 1 and phase 2. And the benefit of that is it cuts down on the time in the middle to get the funding. Traditionally, from time of application to award, it's around 6 to 8 months. And so if you're able to submit a successful fast track, you won't have to wait. You won't have to apply for the phase 2 and then wait that additional time to actually get the money in your hands. So the critical differences between SBIR and STTR. So STTR is really focused on having institutional partners, universities. SBIR allows them, but they're not required. For SBIR, you may outsource around 33% of your phase 1 activities and 50% of your phase 2 activities. For STTR, 40% of the work minimum should be conducted by your business, and 30% should be conducted by your research institution partner. And then I think one of the biggest things is your PI's primary employment for an SBIR has to be with the business. For STTR, it's really just 10% can be to the business, so they're really allowed to stay in their primary appointment with the institution. This is just an overview of our portfolio, and if you're interested, I can send you another slide that breaks this down even more. But we fund a majority therapeutics, but it's really anything that touches cancer, devices, diagnostics, digital health. We're seeing more and more. And at any given time, we're funding around 450 projects. 80% of our projects are grants and 14% are contracts. And then, I don't know why that went back. So right now I'll just go over a little bit in detail about our funding opportunities. So we can start with going over the difference of grants versus contracts. So one of our biggest funding mechanism is through the omnibus solicitation, which is the investigator-defined award. So 3 times a year, January 5th, April 5th, and September 5th, you would submit your application. It is truly defined by you, however you are treating cancer, whatever kind of technology you're using, that is what you would submit. And then this is reviewed by the Center for Scientific Review. And then I would say, number one, to get started with this process is to reach out to a program officer in our office, because they will really help you, guide you through this process of applying for a grant. And so once you apply, you'll go through the peer review that I mentioned. For your reports, you just do a final report at the end of your phases. And then the contracts, so these only come out once a year, and these are defined by the NIH. So we go to other divisions within NCI and talk to them about, what they think is needed in their specific areas of expertise. This goes through a whole process, and then we come up with a list of, I think this past year it was maybe 14 contract topics, and I'll show an example of those in a minute, that you can apply to if your technology happens to fit into that certain topic area. And so again, that's only once per year. It's a lot more oversight. You have quarterly presentations and final reports. You aren't really allowed to interact with our program officers on the same level, and you'll be contacting the contracting officer within the Division of Extramural Affairs. So this is just a list of our current funding opportunities. Like I said, that omnibus solicitation is really our main one. We also have a lot of notices of special interest, and these are all listed on our website, and they'll change from time to time. So we have one that is for technologies for low resource settings. So these are really just ones that we are hoping to see more applications come from. So when you apply through the omnibus, you would just mention that you're applying with the NOC. We also have the ones toward the bottom. I'll go into more detail in a second, but we have a lot of really cool new programs, like the Small Business Transition Grant and our Innovative Concept Award. And then I mentioned our Bridge Award and our contracts. So our Small Business Transition Grant, this is a newer program. This was kind of modeled after the K99R00 award. And so instead of we really see the gap of postdocs going that academic path, but we were seeing that, there really isn't a way for them to start on their entrepreneur path if they were wanting to take their technology outside of the university. So we created this Small Business Transition Grant, which is a fast track mechanism, STTR, that will then transition to a phase 2 SBIR. And for the phase 1, the postdoc would stay with their institution for about a year. They have to have a business and technical mentor, and then they're required to go through the NIH I-Core program, which I'll talk about later. So the PI is really prepping their technology and then transitioning it out into a small business. And so once they move to the small business, the mentoring still continues, and then they're awarded that $2 million award. And our program director for that program is down here, Saroj Regmi. So if you're interested in that, please introduce yourself to him. Next, we have our Small Business Concept Award. So this is a phase 1 contract. And this is to fund really out-of-the-box ideas for treating rare and pediatric cancers. Little data, if any, is required for this award. You submit a white paper, and then you're invited to submit a full application, and the application is much shorter than your traditional grant application. And so if you are awarded a concept award, you're expected to go through the I-Corps program with this as well. And a lot of these programs are currently closed, but I think they'll open around the summertime with into summer, fall due date. And then again, our Phase 2B Bridge Award is $4.5 million. Like I said, you're expected to raise third-party matching funds, and this is really beneficial if you're going out and trying to get other funding, because you can say, hey, look, I have this award from NCI, you can put in the same amount and get way more bang for your buck. And so the success we've seen with this program is that Bridge Award recipients have leveraged $65 million in NCI funding with $358 million in follow-on funding. So that's really a 5-to-1 match, which is really, really good to see for us. And the sport has resulted in 17 clinical trials, 19 product launches, and then, as you can see, more wonderful things. So this is a really great program. It was previously a $4 million award, and it has kind of continually increased and now is at that $4.5 million. This is an example of the last fiscal year's contract topics. So the ones that come out this year will not be the same. They might be similar, but this is just an example of what will come out, and then you would apply to the specific area that matches what you're doing. And then we have some supplemental awards. So once you're already funded, you can apply for an administrative supplement for unforeseen, circumstances and support that you would need. This just goes through our programmatic review, and once you're assigned a program officer, you would just talk to them about needing an administrative supplement. You have to have an active award, and it's kind of a rolling basis. So if you do have an award and this is something you're interested in, just check with your program officer. And then we have a diversity supplement. So it's really to improve the diversity of the research workforce by recruiting students, postdocs, fellows, et cetera, into the small businesses. And so the budgets are limited to no more than the amount of the current parent award and must reflect the actual needs of the project. Again, we recommend you check with your program officer if this is something you're interested in. And then this again goes through review within our program and our office. And then the last one is the commercialization readiness pilot. And so these have that same 3 deadlines. And this is $250,000 to have that additional help with regulatory support, reimbursement, or your IP strategy. And so you must have an active Phase 2 or Phase 2B for this additional money. And again, talk with your program officer. And then this goes through a little bit more peer review. So it's a little bit more competitive, but to get that money as you're getting farther along in the commercialization journey is really critical. This is one of our success stories. So we funded Immunomedics back in 2012, and they used the money to fund their first in-human trial of Trodelvy, and then it was approved by the FDA in 2020, and then in 2020 as well, Gilead acquired the company for $21 billion. And so it's just great to see these stories come out. Obviously, it takes some time, but we're really proud when these kinds of stories happen. And so to get started with the funding side, we recommend that you read the solicitation you're interested in. There's something called the SF-424 that you can go through to understand the requirements. It's all very dense and very long information. So again, reach out to me, reach out to Saroj, and we can connect you with the appropriate program director in our office. We have, I think, 12 of them, and they all have different areas of expertise. And our office solely focuses on SBIR and STTR projects. So we're the only centrally managed SBIR STTR program at the NIH. And then you can look at similar projects through NIH Reporter. You can just type that into Google, and you'll be able to search a database of companies similar to yours, and you can see how they wrote some of their application. And then we have sample applications, and I believe we're getting new ones soon, so you can go to those links. And then we have the peer learning and networking program, which I will talk about in just a second. And so assistance and initiatives. So we provide funding, obviously, but we also have developed a suite of programs to really help in all of the other business and commercialization areas that our companies and even companies that haven't applied will need. And so throughout our phases, we have applied different programs that really help with the needs that you have during those phases. And so first we have the plan webinar series that I just mentioned. And so this is really an opportunity to learn from your peers that have been through this process and had success. So we've had ones on first steps to starting a small business. We just had keys to a successful IND submission. And so what you would do, we usually have around 4 speakers. They submit a 10-minute video just talking about their experience in these areas. We post those on our website. You can go watch them. And then we have a scheduled 1-hour webinar with them where you're just allowed to ask them questions and pick their brains a little bit further. And then we have the NIH Applicant Assistance Program. So this was really created to help people apply for our program, people who have never won or applied for SBIR, STTR awards. And we really, the outreach for this, we really want to encourage businesses that are owned and run by women, racial and ethnic groups that are traditionally underrepresented in biomedical research, and those from socially and economically disadvantaged backgrounds, and then the 20 or so NIH idea states. And so this is a 10-week program that provides you a mentor who will really walk you through this process. The whole grant writing process is extremely tedious, so this is great to have a mentor to help you along the way. And so these kind of run up to our omnibus deadline. So if you're thinking of applying in September, for example, there would be a program a few months ahead of that, and then it would line up with when you're hoping to submit. And so you would have a one-on-one weekly mentoring. They would review your entire application with you and give you guidance, but they will not write your grant for you. They're just there to guide you. And then we have I-Corps at NIH. This was a program that was modeled after the NSF I-Corps, but our office started it within NIH. So now 24 institutes participate along with the CDC. And this is really an intensive entrepreneurial boot camp where you are expected to just really flesh out your business strategy. You're expected to conduct at least 100 interviews in the 8 weeks. And you really, it's experiential learning. You really want to see if your ideas are going in the direction where they should be going. And it's a 3-member team when you sign up. And this is for phase 1 awardees, by the way. And so you have the PI, an industry expert, and then a C-level officer. And then this is what I focus a lot of my time on. So we really, we know that, having almost $7 million for one project through non-dilutive funding is pretty great. And we fund projects, by the way, so you can have multiple grants at once. But just for one project, you can get around $7 million. So that's wonderful, but at the same time, it's not enough. And so we really want to try to help our portfolio connect with the investment community. And so we've been networking for 15 years now and have a list of around 400 industry-leading investors and strategic partners that we pull from every year to review our portfolio. And that's kind of what I'll focus on today. We also do pitch events, one-off pitch events, and we work with some pharma companies to do mentoring days. But I'll focus on our portfolio showcase program. So once a year, if you are in our portfolio, either a current awardee or if you've been awarded in the past few years, you're eligible to apply for this. It's about a 7-page application, and it's just everything you would put in a traditional pitch deck. I then go and recruit around 70 people from our investor network to come and review those applications. Your application will be reviewed by around 5 to 7 people with specific interest in your technology area. And I think that's really important because we have seen deals come from just the review. And so it's really, really cool. Even if you aren't selected for the program, you get all of the feedback from your reviewers. So that's a benefit for everybody. We usually receive around 100 applications from our portfolio, and then we, out of that, select 30 to about 40 now, with stage and technology appropriate events like RESI, Bio, Precision Medicine World Conference, and just all of the big industry events. We'll pay for you to go present, we'll help you prep with networking, we'll help pitch coach you. And then now a new thing is for some companies that, as we're walking through the review process, we hear a lot of comments that, this company could use this kind of mentoring, and then they might be ready to go out and pitch. And so we are now funneling some of those companies into another program that I'll talk about, a mentoring program that we have, so they can hopefully then get that mentoring needed to reapply and then hopefully be successful in the future. And then, we also develop an investor book. I have one somewhere if you're interested in looking at it, with all of the executive summaries of the selected companies. And then, as I'm traveling, as other people in our office are traveling over that next year, we're meeting, people in our network, new people that are coming into our network, and we're really showcasing those companies. But even if you're in our portfolio and you aren't a part of this program, we're sending out our entire portfolio to our network all the time. And so, as a government official, I can't be going out directly to the investor and giving them a specific company. We have to be equal to every company in our portfolio. So through those materials, we'll get a lot of requests for an introduction, and at that time, I can make that introduction. This is a timeline of the program. If you are an awardee, the application will be coming out, I think, around the 25th of this month. And then we have a review, and that ends in, actually, we have a big Zoom call with our reviewers to go into some more details for certain companies. And then once selections are made, those are just an example of some of the events we send companies to. We also have the Technical and Business Assistance Program. So if you are applying, you can request TABA at the time of your application. So for phase 1, this is $6,500 to use your own vendor for technical and business assistance needs. For phase 2, it's up to $50,000. If for some reason you don't request this funding in your application, you can go through the NIH-provided TABA services. So for a phase 1, you would go through a TABA needs assessment, where NIH has a third-party vendor who goes through, what you're doing, and then they provide a report going over the areas that you need to focus on in the areas of IP, market and competitive advantages, regulatory, manufacturing, business model profitability, and so on. And then for phase 2, we have the TABA Consulting Services Program. And so you'll work with the NIH seed office to, to find and solicit a vendor to provide up to $50,000 of services in one of those 4 areas listed. We also have our CARE program. And so obviously we know that finding information about all these programs across the government is a headache. And so we really want to try to connect our awardees with regulatory experts. And so we collaborate with the FDA to let our early stage companies ask them questions. And so you would submit your application with the questions that you have for the FDA. We'll direct it to the FDA, and then you'll receive an informal response to your questions. And so I think the next one, they're due in February if you are an awardee, and then you can go to the CARE page on our website. On our website, too, we also have a lot of other regulatory resources. We have a web page. If that's something you're needing, there's a lot of good information there. And then our mentoring program. So our industry mentoring and assistance program, this provides guidance to our companies on their technical and business needs. And it's a team mentoring. We usually have 2 to 3 mentors from our network come in and meet with you for an hour and a half every month or so. And at the end of each meeting, you have homework leading up to the next meeting. And then we have our Women's Innovation Network, and so we wanted all of the women in our portfolio to have a place, to come together and, learn from successful women in the industry, and then be able to meet in small groups to discuss the topics and just stuff that they're going through in their personal journey as a small business leader. So some of the people we've had are there on the right. And we've just heard really good feedback from this. It's a great place to just hear from your peers, grow your network. It's a great networking opportunity. And we're thinking about taking some of these members and starting kind of more smaller executive roundtable groups where they can expand on these, because I think these only occur like once a quarter. Oops. And then we have our executive roundtable program. So this started pre-COVID in person, actually. We sent out an application request for companies in our portfolio focused mostly on therapeutics. And the 10 people that were selected would meet every 2 months in person at the NCI office in Rockville, Maryland. And it's really just a place to, come together and discuss what's going on, what are you having trouble with, getting advice. It's a really good group of a mix of phase 1, phase 2 awardees. And then the ongoing cohorts are obviously all digital now. And we should have more coming out this year. And one might be funneled from the Women's Innovation Network, and then we're trying to define the other group that we might launch. So these are our lovely program directors and their areas of interest. So if you are interested in applying, I'm happy to be your main point. I will direct you to one of these program directors who can go over your specific aims page with you and then kind of guide you on the process at that time. Everyone we all work very close together, and so I'm happy to make any introductions. And then this is the additional staff that we have. And then you can stay in touch at the bottom of our website. You can sign up for our email updates, talk to a program director. We have a lot of events throughout the year, so if you go to our events webpage, you can see those. And then we have a LinkedIn and Twitter account as well. So I'll take some questions.
Hey, Brittany. We're actually NCI awardees, so thank you for your support. I was wondering, we get these numbers all the time on how leveraged it is, where there's like a certain amount of grants issued out and then a certain amount of private funding that comes in. Mm-hmm. I'm curious if you have, like off the top of your head, numbers on like exit values. Like that one example was interesting. Yeah. I'm sure it was like the best example of like a $21 billion exit, but like, are there like generally like what's typical as far as exit value, or like how many NCI funded startups exit every year? Yeah.
I know we have the economic impact. I'm sorry that I keep going to you. I don't have the numbers off the top of our head, but we did do an economic impact study, and that is on our website, and that has a lot of great statistics about that.
Do you expect that there will be numbers on kind of like exit outcomes published at some point?
Did we do exit tracking? Yeah.
When you look at therapeutics, the exit value might be a lot different than digital health.
Right.
So, it's really tricky.
Hi, Suresh.
I thought I recognized you. Yes.
Brittany, what's the best way to connect with you and also to learn more about like the executive roundtable if we are current NCI awardee?
Yeah, I'll give you my business card. We have meetings after this scheduled, but I'm happy to set up a meeting to discuss for sure.
Great.
Yeah. All right, well, thank you very much.